Welcome to the 2021 ASHP Foundation Literature Awards presentation. My name is Kelly Smith. I'm a past president of ASHP and a member of the ASHP Foundation Board of Directors. Today, I have the pleasure of spending time with 5 pharmacists whose original research has made significant contributions to biomedical literature and helped advance pharmacy practice. Our first award celebrates the career of a researcher whose body of work answers critical questions about medications and medication use. The recipients' publications in the peer-reviewed literature challenge our assumptions and serve to shift the paradigms of current practice. The 2021 recipient of the ASHP Foundation Literature Award for Sustained Contributions is Sandra Kane-Gill. Dr. Kane-Gill's work focuses on effective approaches for detecting, preventing, and managing medication errors and adverse drug events. She has successfully incorporated health information technology like clinical decision support and telemedicine in practice to promote improved safety and quality of care for patients. She also applies implementation science strategies to ensure the adoption of medication safety practices. Welcome, Dr. Kane-Gill, and congratulations.
Thank you, Kelly. I really appreciate it. It's so very special to be recognized by ASHP for this award. I feel truly honored and greatly appreciate it. Thank you.
Indeed. Well, I know that when you started your career, you were primarily focused as a clinician and then got more involved in research. How did this happen?
I think this has really come about because my interest has always been to improve patient care. That's why I pursued a career as a pharmacist. Initially, the idea of research really wasn't that appealing to me. I had that vision early on of an individual who was working in a wet lab, that traditional basic scientist. And as my understanding of the profession grew, I then learned that there was multiple paths that pharmacists could take. I eventually realized that I could pair both my passion for patient care with research in the form of things like clinical research, clinical trials, medication safety evaluations, and also data science. So how it really happened for me was a realization that our profession is multidimensional and that I had the ability to combine many facets into a career that would drive me to make a difference for patients.
Tell us a little bit about the pharmacist role in this clinical area.
So I feel like each of the questions that I've tried to address with my research in medication safety related to kidney disease works towards evidence-based strategy to improve kidney health. And when combined, really, you can evolve into this coordinated effort for nephrotoxin stewardship. So the pharmacist's role is to lead this nephrotoxin stewardship effort, pushing towards zero tolerance for preventable adverse drug events, preventing progression from acute kidney injury to chronic kidney disease, mitigating the severity of an AKI event, and really with this overall goal of optimizing a patient's kidney health.
Well, your comments certainly have likely inspired many to consider research in their careers. What guidance would you give a newer pharmacy researcher?
I think my best advice would be to follow your passion, right? When you get involved in an area of research, it often lasts for a lifetime. And so if you're following your passion, it won't feel as much like work and a little bit more like enjoyment. And so I think following your passion would be the number one words of advice that I would have. Others would be getting involved in research is definitely a way to settle that nagging curiosity. So consider how you can incorporate it into what you do. I think that it would also be to find great mentors. I've had some fantastic mentors that challenge me, that inspire me, and they've really just had a tremendous impact on what I do. I think it sounds cliche, but research is a team sport. But finding that great team is really important because you cannot do it alone. And I think my last words of advice would be to engage new learners right? These new learners are our future for research, and they offer us fresh perspectives and they keep us thinking about the next step of our research. And so I think that's important as well.
Well, Sandra, you certainly shared and demonstrated a number of the tips and pearls you've just reminded us of. That passion, that intellectual curiosity, that team-based approach, finding mentors. We're all grateful and appreciative and congratulate you for bringing that to your research every day. You're so very deserving of this recognition.
Thank you very much, Kelly. I really do appreciate it. Thank you.
The next award is the Award for Innovation in Pharmacy Practice, which recognizes articles describing noteworthy changes in pharmacy practice in hospitals or health systems. The award-winning articles are models for novel approaches pharmacists can take to improve patient care. Our 2021 awardee is a compounding compliance team at an academic medical center. The research was published in AJHP. Representing the author team today is Dr. Bruce Chaffee. Congratulations to you, Bruce, on behalf of the entire authorship team.
We're very honored to have been selected for this award. I want to thank the ASHP Foundation for offering this opportunity to me and the many other practitioners across the country that work to improve pharmacy practice each day. I want to thank my co-authors, including Jamie Tharp, an exceptional practitioner who provides leadership for our compounding compliance team, Stan Kent for emphasizing to hospital leadership the importance of having the right size team to do the work the right way, and John Clark for his continual reminders to the staff of the importance of our work to quality patient care. I also want to thank Michigan Medicine leadership for recognizing the importance of the team, the pharmacy managers who help to implement the standard operating procedures, the pharmacists, and most importantly, the pharmacy technicians who do the critically important compounding work on a daily basis. Personally, I wish to thank my wife for editing skills and patience with me for all the time I spend doing my work in the off hours, and Mike Ryan for challenging me at a young age to be a better writer.
You talked with us about the importance of teams and building teams and doing things the right way. An element of that is changing the culture. Why was changing culture an important aspect of this particular project?
Yeah, thank you for that question. Very challenging. Like many other professions, pharmacy is continually faced with the competing demands for efficiency gains while facing increased workload and regulatory scrutiny. Several regulatory audits highlighted areas where we were not performing our work at a level where the highest quality of our sterile compounding could be assured. We needed to fix that by becoming national leaders in hospital sterile compounding quality. The only way to do that was to change our culture. A key step in doing that was to instill in the organization leadership the importance of doing this highly detailed work the right way, while clearly laying out for our staff the best practices that we needed to follow. This required substantial education of everyone who performed, supervised, or provided administrative leadership for pharmacy compounding, all the way up through our chief medical officer. In order to help health system leadership make the right decisions, we also needed to provide them with the right information about our resource needs. We completely described the program, its intended outcomes and costs, and also how we would monitor our progress towards achieving those outcomes.
These are some fabulous insights. Thank you so much, Bruce, and your team. Great work at Michigan Medicine.
Thank you very much, and thank you again for this great honor.
The Pharmacy Practice Research Award recognizes an important contribution of original research to the peer-reviewed literature related to health system pharmacy practice. This year's award goes to Impact of Collaborative Clinician Visits on Post-Discharge Total Cost of Care in a Polypharmacy Population. The paper was published in AJHP. Dr. Joseph Hergis is here representing the author team. Welcome, Dr. Hergis.
Thank you, Dr. Smith. It's an honor to receive this award. I had a fantastic research team and want to thank all of my co-investigators who made the project possible.
As we consider the work of you and your co-investigators, some of us may observe that polypharmacy and transitions of care aren't necessarily entirely new areas. So tell us a bit about what's new about your research.
Though it's true that polypharmacy and care transitions are not new research topics, most existing literature focuses on clinical outcomes, such as hospital readmission risk. However, there is limited data on the cost impact, particularly of pharmacist-led transitional care interventions and those within primary care. Another unique aspect is that rather than just focusing on the cost of hospital readmissions, we also examined emergency department visit cost and outpatient cost. We also specifically focused on patients taking medications shown to increase the risk of emergent hospital admissions. And we hypothesized that pharmacists may identify medication problems and solutions related to these medications that could translate to better patient outcomes.
So it's great to truly hear how you're broadening the impact of the spectrum that's been measured. Given your findings, what would you tell the C-suite about your research and your measured outcomes?
I hope the study speaks to healthcare institutions that don't have pharmacists currently doing transitional care work within primary care. There may be hesitation to add a pharmacist within primary care due to the cost of the resource, but making that initial investment may lead to better clinical outcomes for patients and may actually translate into cost savings as well. We also hypothesized that cost savings would come primarily from hospital readmissions. But interestingly, we found cost reduction related to emergency department visits and outpatient cost of care as well.
So certainly, as you're sharing with us, it takes a team and it's all about how it's impacting patients. Thanks for those perspectives and thanks for the work of you and your research team. Congratulations.
Thank you so much, Dr. Smith.
The Drug Therapy Research Award addresses the therapeutic uses of medications. The award celebrates an exceptional article and highlights research that influences optimal medication use. Our 2021 awardee is Association of Timing of Initiation of Pharmacologic Venous Thromboembolism Prophylaxis with Outcomes in Trauma Patients. This research was published in the Journal of Trauma and Acute Care Surgery. Representing the author team is Jason Hecht. Congratulations to you and the team, Dr. Hecht.
Thank you. On behalf of myself and all of the members of our research team, thank you so much to the ASHP Foundation for this incredible honor. I'm really proud of what we were able to accomplish as a research team, and that we did it, most importantly, collaborating as an interdisciplinary team of both pharmacists as well as trauma surgeons from across numerous health systems in the state of Michigan. I really do want to thank and recognize each member of the team that worked tirelessly on this project. Dr. Wendy Wall is a trauma surgeon and surgical intensivist at my home institution of St. Joseph Mercy, Ann Arbor. And really, she served as my research mentor early in my career. And it was great to be able to work with her again on such an amazing project. Dr. Mark Hemela was the founder of the Michigan Trauma Quality Improvement Program, which is the collaborative database we used to record data for this project. And he works as a trauma surgeon at the University of Michigan, and it was wonderful to have him involved on the project and all of his insight from his years of experience. Dr. John Scott was a trauma surgeon also at the University of Michigan who contributed greatly to the study design. Ann Kane Nielsen is an incredibly talented biostatistician and put up with each and every request that we had about how to analyze this project, as well as contributing brilliant ideas about how to analyze the data and move forward with pushing the project towards publication. And lastly, Dr. Emily Hahn was a pharmacy resident at our institution who worked with me on the project. And she really was the motor behind the project that made all of this possible. We really are so proud that this project started as a residency research project. And it was wonderful to have the opportunity to have a young and up and coming clinical pharmacist like Dr. Hahn working on such an impactful project as we were able to push it through to a very successful publication.
Well, what do you believe from this work is the most important takeaway?
I think the clinical takeaway for me was clear. We looked at 80,000 trauma patients, and early DVT prophylaxis started within 48 hours of admission, and likely even within 24 hours of admission, dramatically decreased the risk of venous thromboembolism, and really did improve patient hospital outcomes across the entire spectrum. These results were translatable to nearly every subpopulation that we looked at within trauma, and that included included patients with severe injuries and polytrauma, as well as traumatic brain injuries. However, I think the bigger takeaway from this project for me and hopefully for others is that it's okay to dream big with a residency research project. And it really is amazing what you can accomplish within the course of a year if you have a clear plan laid out, a novel and strong research idea, and most importantly, the institutional support to be able to make it happen.
Well, thank you, Jason, for those incredible takeaways, and congratulations again to you and your team on some excellent work.
Thank you so much. I really appreciate it.
Our final award recognizes a pharmacy student's exceptional published research paper describing a research project related to medication use that advances patient care and pharmacy practice. The 2021 recipient is Netta Cazzaroni. Dr. Cazzaroni's research, Pharmacy-Related Buprenorphine Access Barriers, an audit of pharmacies in counties with a high opioid overdose burden, was published in Drug and Alcohol Dependence. Hello, Netta, and congratulations.
Thank you so much, Dr. Smith. It is such an honor to be able to accept this award from the ASHP Foundation for our work on buprenorphine access barriers among community pharmacies. Thank you again, Dr. Smith, to you and the foundation and the review members for encouraging pharmacy students to get involved early and to pursue meaningful and timely research to important areas of issues that affect our nation. So I would like to extend a thank you to our principal investigator, Dr. Daniel Hartung, Dr. Adrian Irwin, and Dr. Jimena Levander for their guidance and mentorship on this project. I also want to thank Drs. Carly Gostanian, Bailey Mayfield, and Brandon Montgomery for their willingness to support a friend and a colleague.
Thank you for those comments. And I found it fascinating that you used a secret shopper methodology for this work. Why was that method so important to the goals of your team?
Yeah, so the intention of this research study was to assess the access and availability of buprenorphine naloxone from community pharmacies. So if a patient calls into a pharmacy or presents to a pharmacy counter with a prescription for this medication, what is the likelihood that the pharmacy is going to be able to fill it? Do they have it in stock? What sort of barriers are going to be present? And so to get that true patient perspective, using a secret shopper methodology was the best approach to do that. This approach was also implemented to assess access barriers to buprenorphine naloxone prescribers in a primary care setting. So it was a natural next step for us to be able to assess medication access from a pharmacy standpoint using a similar approach.
I'm curious then, given the work that you've done, what are some key messages or takeaways you hope for our health system pharmacist colleagues to know?
So takeaways for pharmacists would be that among independent pharmacies and U.S. counties with higher than average opioid overdose rates, we identified barriers to access in nearly 30% of pharmacies contacted, with 1 in 5 pharmacies being unable or unwilling to dispense buprenorphine entirely. So these barriers were more common among independent pharmacies and pharmacies located in southern states. So although buprenorphine is becoming a more commonly accepted treatment modality to aid individuals with OUD, we still have a really long way to go to debunk any preconceived notions about this medication as compared to full opioid agonists, and to ensure timely access to this medication among communities hardest hit by the opioid epidemic.
Well, you've mentioned that we have perhaps a long way to go in this arena. So what's next for you and the research team?
So we hope that our research can be used as a stepping stone for further research and inquiry to be conducted and to dive into why these barriers, these restrictions, any red tape is present within our nation. As identified by our research team within the study, investigation into these barriers is already underway. I also strongly believe that pharmacists have a role in reducing opioid use disorder stigma, and any collaborative efforts between buprenorphine prescribers and community pharmacists needs to be present in order to ensure timely access to this medication and to decrease the potential for OUD relapse. So I'm hoping that our study can be used to support future collaborative efforts between pharmacies and prescribers.
Well, Dr. Cazzaroni, it's clear this collaboration was incredibly successful. Congratulations to you, and we certainly look forward to seeing more great things from you in your career.
Thank you so much, Kelly. I appreciate it.
That concludes our presentation. Congratulations again to all of our awardees, and thank you for joining us to honor these exceptional researchers and their impressive work to advance pharmacy practice.
For more information about the ASHP Foundation Literature Awards, please visit ashpfoundation.org.